If you are looking into medication-assisted treatment and considering your options, surely you've heard about Suboxone. Suboxone is a medication-assisted treatment for those who are experiencing an opioid use disorder. It contains a partial opioid agonist called buprenorphine and an antagonist called Naloxone. Naloxone is better known as Narcan. People often wonder if Suboxone is just trading one drug for another, and if it can get a person high like other drugs. The answer is that yes, Suboxone can produce feelings of euphoria, but there are some key differences between Suboxone and other opioids. The first being that compared to other full-antagonist opioids like heroin, methadone, or morphine, one of its main drugs, buprenorphine, is only a partial antagonist. When a person takes Suboxone, it takes up their receptors in ways that doesn't allow other full-agonist drugs to work properly. Full-agonist opioids such as OxyContin, heroin, fentanyl, morphine, and methadone can produce intense highs, and that is what makes them so addictive. A partial agonist opioid like Suboxone is not as strong, but it can still help regulate your brain and provide relief of withdrawal symptoms without giving you an intense high. While Suboxone is not a cure for opioid addiction, it can be a short or long-term tool. If you're thinking about getting help for opioid abuse, Suboxone may be a perfect fit into your treatment plan. To find out what would be best for you, always consult a doctor and be open and honest about your concerns. Of course, because Suboxone is a partial opioid agonist, it does have the potential for abuse. Hopefully, you are seeking out treatment with the intentions of leaving behind the feeling of being high. Suboxone can give you some feelings of euphoria, but nothing compared to what you are used to when you're abusing full agonist opioids like heroin, oxycodone, morphine, or fentanyl. The feelings of euphoria that are associated with the use of Suboxone are usually only in the very first few weeks of treatment. Once you have adjusted to the medication, you will usually get over those feelings of euphoria and level out. The idea behind medication-assisted treatment is to get you to a place where you can feel normal and live life like you used to. As long as you take your medications as prescribed and you are honest with your doctor so that you can adjust your dose, you should be fine. Suboxone is a valuable component of a successful addiction treatment program for many people. It's effective in suppressing powerful cravings and other severe withdrawal symptoms that opioid addiction is notorious for. Suboxone-assisted treatment is not a sufficient treatment for opioid addiction alone. An addiction is a mental illness that requires psychological treatment and long-term care. Although abuse of this medication is possible, the combination of the buprenorphine and naloxone make it less likely. Suboxone addiction symptoms are quite like that of opioid addiction, but milder. Using more Suboxone than your doctor prescribes in a day and a preoccupation with getting more of it are signs that you may be experiencing a Suboxone addiction. If you think you might be, contact your doctor and tell him or her the truth. Your treatment can be adjusted to get you back on track. Always avoid alcohol and other opioids while taking this medication. Consuming a mixture of these substances can have fatal consequences. Seek medical assistance immediately if you experience symptoms of a depressed respiratory system while using this medication, as this can lead to brain damage or death. We hope that you found this video helpful and informative. On behalf of Find Suboxone Near Me, thank you for watching.